Today, I want to invite you to follow me on this strip surgery hair transplant. You have three methods of doing a hair transplant. There is FUE, FUT, what we're going to do today, and body hair transplant. Today, we have a lot of people that shouldn't be doing hair transplant, which are not doctors, doing these hair transplants, because the strip technique must be done by a hair transplant doctor, a hair transplant surgeon, because there's a lot of secrets, there's a lot of detail to leave no scars or very well camouflaged scars, and I think this is the best way of getting rid of these people that shouldn't be doing hair transplant low cost, and they're doing it. So please follow me today to see this hair transplant technique. Do you have any other surgeries on your scalp?
No, not on my scalp.
Just that. Yeah, just relax. Oh, you're so tall.
I know.
Go a little bit higher, right on the scar. How do you feel about that?
I like it.
What you see there, the problem is coming on your own, is that you just have one picture.
I get you.
Because this is 2D. This is where it's going to come out on every picture that you take.
Right.
But what we see is something different, because we're seeing in 3 dimensions. So I have to match what we see. That's why I use the mirror.
Makes sense. Yeah.
So I use the mirror to see if I'm having the correct dimensions and symmetry. Okay, good. So the question now is, do you want me to do the irregularity? That means, you know, it's not a straight line.
I think so.
On the black line, below immediately below the black line, or on top of the black line?
I think whatever looks more natural.
Okay, I normally work on top of the black line. So I use the thickness of the black line to make the irregularity.
Perfect.
Yeah? Do you like that shape?
I do. I think it looks really good.
I love it. Yeah.
And it's covered the scars, which is really big.
Yeah. And check the back.
Okay.
You can see where we're going to take the strip from. What I need to know is check where your scalp starts. And go a little bit higher than that. Check that there's elasticity. Now we're going to check that we like those hairs, that they're nice and beautiful follicular units on the strip that we're going to take out. Yeah, that's very good. Okay. Yeah, that's beautiful. We're going to collect you now, the nurses.
Okay.
We're going to get you changed, and we're going to shave the strip and separate the hair from the area that we're going to do the surgery.
Let's do it.
Look at me again, to the other side, and more. Good. Okay, so we're going to just shave the area of the strip. All right. How was that? Good. Do you feel any pain? No. It's just what's going on, no? What I just did is that we can take it like that. It might feel bad or horrible, but we don't have any bleeding. Look. Okay? So that recovers very fast. Mosquito?
The doctor's just extracted the strip, so now we're going to make small slices called slithers. So we take the strip and we use a microscope or loop to make fine slices showing the follicular units. And once we have those, we pass them to the next technician and they cut them into individual units. You just have to take fine slices that are 1 hair thick, very, very tiny. So when you're looking under the microscope, you can see everything's super easy. Everything's very magnified, so you can see each graft unit, and you slice slowly with the blade up and down.
So final result, clean, beautiful, everything well together, no swelling, no pain. We're going to turn her over, we're going to start doing the anesthesia on the front and incisions. I'm going to start with incisions, beautiful. Okay. I'm going to move your head a lot. We made a design of incisions coming this way, and then we have a partition, and they're starting to come back, facing this way. So that's how the natural line is going to go. These ones are going to come out like this, and they're going to go down backwards, and these ones are going to go to the right. Okay? So she's not going to have that ugly look of hair transplant. It's going to be all blended and natural. And we're going to choose the fine ones for the front line and more dense, the thicker ones, and 2s and 3s as we go back. And on top of that, we're going to do a transition zone. So where she's healthy and nice, we're going to still blend it with the new hair transplant. So we don't have any steps or anything. Everything is going to look natural and nice. On this side, the same. They're not going to go back. So it's going to be so natural and nice.
I feel really good. There's no pain. It feels strange because you can feel the apparatus.
Okay, so we just seen a strip hair transplant technique. As you can remember, we have 3 techniques for hair transplant: FUT, strip technique; FUE, or body hair transplant. I think a surgeon must know how to perform these 3 techniques because he's the responsible of recommending the best choice for that client, for that patient, and plan future surgeries. I think the FUT or strip technique must be the first surgery for everyone if it's a big surgery. I'm talking in general, of course, we have to evaluate each case in particular. This technique, as you can see, it needs more staff, it's a little bit longer, and it requires more skills from the surgeon because this strip technique might have wide scars. But if you have an experienced surgeon that has a lot of practice and they know the rules, you're going to have almost no scar or a very well camouflaged scar. There's a lot of people right now doing hair transplant, low-cost hair transplant, that we don't even know if they're nurses or auxiliary nurses, and they're performing FUE hair transplants. So this is a good way to get rid of this black market of hair transplant. I think the best place to go and do a hair transplant is a place where the surgeon can do all of the techniques so you can have a good recommendation. I hope you enjoy this today. I'm Dr. Pano from Marbella.